You're about to hear an exclusive interview between Kal Patel, one of the founders of Meditab software, and Tony Downs, the CTO of Cumberland Family Medical Center. Meditab is currently celebrating their 25th year anniversary, and Cumberland Family Medical Center is an FQHC that's rapidly growing with over 200 locations and 1,000 staff members.
So Tony, thanks for sitting down with me, at our 25th year users conference. Appreciate you joining us. And I just want to, as I was reminiscing about Meditab's 25 years, I still remember your group, Cumberland. I remember this many years ago driving to Kentucky. And at that time I met Dr. Loy. And at that time you guys just had, I think, one location, maybe two. And I think as, you guys saw our product and selected it from those years, I realized that, we've been growing together since that time. And I think it's been, 14, 15 years now. During these years, most marriages don't last that long. How are we still together? What is that we've done right for you guys?
Well, we've, just like you said, we've grown over the last 14 years. We went from just being a small, very, very limited practice clinic to now we're a little over 200 clinics. We're located in several of the counties and all over central Kentucky. We've got about 1,000 employees now. So through the years, you guys have always kept up with us or just a step ahead of us with the product. So IMS has really been, our only thought really was, how do we improve and how do we make IMS grow? And we've worked together to make that happen.
So during this process, I know you guys gave feedback. How was our team's response? Any special projects, anything that we work with you guys because I know you guys gave us a lot of input.
We never have a delay in service. We have a dedicated team that actually we call directly, and if there's any issues, that can be escalated almost immediately to whatever level that we need. So the service has been, incredible. You can't ever expect or even think about any other company that you would work with. And I think that may be why we stayed married, that we work good together. And as the response and the service and the access to you at your level, or Mike or Paragi or Ronak and his team, or at the time Bahavish and his team, you don't have that in any other EHR.
We appreciate that, and I think a lot of it is also the input that you guys gave that I think helped the product improve. Right now, it's for your organization, what are all the different specialties that you guys do? You have 200 locations.
Right. So we are now working with OB, and that was a complete build from scratch. We actually acquired an OB practice, and just to let you know how our partnership works, we acquired that practice. They were using DigiChart, and we wanted to move them into IMS. At that time, IMS had just an outline, basically, of an OB charting solution. We made the phone call, worked with your team to get things set up on a development phase, and actually went from zero to probably the best OB module that you would see in just a few months. So you guys did that with us. That's that's one of the partnership projects we did. Now we've got pediatrics. We do counseling, which is also another development project that you guys work with us on, getting those counseling forms and getting, where we can do our LCSWs for outpatient counseling. So we have dental now, and we're working with you guys on developing a dental module that seems to be really, really, exactly what the dentists are looking for on it. So we do, of course, family care. So.
Yeah, and in an FQHC, I know you guys have some unique requirements with this data, so having everything in a single database is definitely important. And what do you feel is the most important in a FQHC by having all of the data in a single database?
Our reporting is probably the biggest thing, and just like you said, we have several federal requirements that we have to meet, and those UDS reports, being able to actually get that data into a form that the government requires and do that in a timely fashion is, of course, that helps us with our funding and helps keep things affordable for our patients, which, a lot of our patients are underinsured or no insurance. So that's a very important part of it. And you guys have come a long way with that. Back in the old days, UDS, you would, wait for the guidelines from the government. You would have to, make a build that gets put into IMS, and then we get those numbers. And now with the new UDS portal, those numbers are going to be ready for us, and we'll be able to pull that, on the fly. So that's going to really speed things up. That was a real pressure point for us in the past, is being able to, with as many clinics and as patients as we have, getting that report finished after the government came out with its, how this is how it's going to be this year.
And, as your organization continues to roll out IMS, are there any new specialties that you're planning on going into?
We're looking at optometry, and we're looking forward to testing that and actually being able to utilize that, especially starting off. We're going to be in schools, so a very high priority for us is our children, and that module being there will allow us to chart those patients in the school. You beat us to the draw on that one.
We developed ophthalmology with another amazing group out in Atlanta that we've been working with over 2 years. I think ophthalmology is the only one that we didn't, get started because of you guys.
Of course, that's our newest. It looks like you're way ahead of the game on that one. It looked really good to me. I'm not an ophthalmologist, but just looking at what's there, it looked like a very, very good module for IMS to have.
I know we have some special functionality for FQHCs in there from the registration. Can you talk a little bit about any of those features that you think are really helpful?
Well, the biggest, I guess, and we hit the UDS, but the FQHC portion, of course, all of the regs, all the federal requirements, being able to meet those requirements with your development, that really helps us keep on track, and it makes our income. We were able to actually get these levels of treatment and care by keeping our patients out of the ER, keeping them in the clinic. One of our big missions also is to be able to treat all of our patients and actually provide care so they don't need to go to the hospital, which costs a lot more.
True. Quality of care, right?
Yes,
that's the model. And we're also focused on continuing to improve that, and we hope we have your support. We just love taking input. From that standpoint, is there anything that you felt in terms of development or anything? How do you feel about the responsive time for those items?
I probably can't stress even how responsive, and that would be an understatement, how quickly you guys respond to any request. We'll go from an idea to a finished product in just a few months. That is very impressive. And as Ronak and as your team will attest to, when we decide that we're doing a specialty, we're already starting, we're already ready to do it. So, we call Ronak and say, hey man, can you have it done tomorrow? We know that he can't do it that quick, but it's very quick, the response time. And he gathers a team, or if he's not the person, he'll get someone to put together a team that meets with us regularly and develops and gets these products rolling out, because once we decide we're doing it, and we're halfway there, and to be able to keep up with that's you guys are impressive.
And during your growth, right, obviously going from, I'm still amazed though, I tell you, going from when I visited you guys, that was the beginning of Cumberland. I still remember this. And over the growth, what can you say about clients from an IT perspective? What was important and what allowed your organization to grow, from an IT level?
From an IT standpoint, being able to and having the one platform is important, because of security, the actual physical server, being able to have a product that we can house and we can actually maintain ourselves. That was very important for us. That was a solution you offered. But at the same time, being able to deploy and not having to worry. I've had this question as we've gone through the years. When are we going to get capped out? How many clinics can you actually have? And so we're pushing over 200 now, and that's a lot of employees and a lot of users, and there's no cap really. That's something that you run to a point that you think, well, what's our maximum? and the sky's the limit. I think, the database continues to grow. Our document size continues to grow, and it's no limit. That's important.
Good. Yeah, the technology is no limit, but I know one of the things we've seen, because as we work with practices, is from an IT perspective, it also depends on what you're doing. So I think you've done a commendable job growing the IT to grow with the size, because it's not just the software. I think without your team's efforts, I'm sure our product would not have looked as good as it does either. So we appreciate that as well.
And it's a product from an IT standpoint. I have a small team. For as large of a organization and as spread out as we are, I only have eight IT guys that.
Wow, for 200 locations?
Yeah, 200 locations and a little over 1,000 employees. So we're able to maintain that, and that's because the product works. We don't have a lot of issues that keep you busy working on your EHR. We're able to actually focus and do what needs to be done to keep the equipment running, keep the network up, and you guys keep us running in IMS. I mean, we'll see a problem. We call your support team or connect to live support, and we don't have to worry about that. You guys take care of it. So it's that makes it easy.
So Tony, I know you got over around 200 locations you mentioned, but how many encounters are you guys doing at your organization?
So somewhere close to 90,000 per month. We're seeing a ton of patients.
Yeah, well, that's impressive. That's a lot of encounters for you guys. So how do you handle that? Because I know I've seen when patients are checking in, there's a lot of things involved, processes. How do you guys handle all that?
But with the system using IMS, we're able to, our front desk staff actually can, and being in rural areas, and we're able to evaluate on intake where the patient falls as far as their economic status. Are they under the poverty level? And that will allow us to use the sliding fee scale, which is already in the system. So based on an income level and a family size, we'll be able to pick up and see, where that family should, or where that patient should fall as far as paying.
So in the check-in process, obviously when they're walking in,
right? Yeah. So
your
right out,
staff knows everything they have to do right there.
Right. Yeah, and it's automatic. You put in a number, and it tells you where they fall right in the system. We're able to do that. We're able to take insurance cards. We put that in the system as they come in. If the insurance changes, it's really quick. Using the portal, they can actually send us their insurance card from a phone, and we can have that in the system already, and then just verify when they come in. All of their consent for treatments, patient access forms, we have all of that already in the system. They see that. We have a binder, and it's on the screen, so they're able to sign all those documents right at check-in. Makes the check-in process very smooth and fast. With that volume of patients, can have a lot of time spent on doing that work, and IMS makes it really easy to flow through that amount.
Well, Tony, listen, man, it's been great talking to you, catching up. Really appreciate your time.
And we appreciate you having us, hosting us.
Yeah.
Thank you.
Thank you.